Hello, my name is Megan Lundstrom. I am the Chief Executive Officer here at Polaris, and with me today is my friend and colleague, Vanessa Bouché. Do you want to introduce yourself, Vanessa?
I am the Chief Impact Officer at Allies Against Slavery.
Amazing. And Vanessa
Yeah.
and I have been worked in the anti-trafficking field for a long time, but also have worked on several different projects more recently. And this is a conversation, Vanessa, I think that is feels very timely, but also when it comes to drug-based coercion, which is something we're seeing in the media right now, something that you have done research on, that I've done research on, and we've also seen a lot around in terms of providing direct services to victims and survivors of trafficking. So would love to hear from you a little bit about what brought you to the anti-trafficking field more broadly, and then more specifically, what really stood out for you around drug-based coercion that caused you to really want to lean into this topic.
Well, wow. The question about how I got into the anti-trafficking field
A whole
more
other
broadly,
podcast.
that's a whole, yeah. It's a long story. But I mean, suffice it to say, I was 20 years old. I was a junior in college. I was a history major. I was in all of these classes on the civil rights movement, on women's suffrage movement, on antebellum slavery, right? And I would always find myself asking questions like, what would I have done if I lived then? Now, I had grown up in a really privileged family and a privileged environment. And so the answer was always like, I actually don't know, right? Like if I would have been willing to give up all of those privileges in order to stand in the gap for an issue that at that time was not the popular perspective. And but I had believed that, I thought, well, we're doing really well as a society and that was my perspective, right? From my lived experience, we're doing pretty well. And then I found out that actually slavery did still exist. It may not, be de jure slavery in the law, but there's de facto slavery that still exists. And when I found that out, I basically was like, well, this is my opportunity to prove to myself that I'm going to step in the gap and that I'm going to do something about it. No idea what that would look like, but it really ended up taking me down the path of doing a lot of research, a lot of advocacy, founding a social enterprise where I was working with survivors of trafficking in India and the US. And so have done lots of things since then, but that was really it. It was, what am I willing to give up in order to step in for those who have experienced exploitation that I have not.
That's amazing. What a journey. I love
Yeah.
hearing every person's journey because I think, um, you know, each one of us has come into this space with a different path, and
Mm-hmm.
all of us have had to go through some really deep reflection of um, how I show up in the world, and is that representative of other people's experiences, and if not, why? And I think
Yeah.
you and I are both social scientists, and so that
Yeah.
why question is always there. So yeah, so thanks for sharing that, and would love to hear more. Like, what's your story? Do you have a like, what's your why story around drug-based coercion? I know I definitely have several that come to mind when I think about this topic.
For me, I was working in a business that I founded with trafficking survivors and that employed trafficking survivors. And one of them had many experiences over the course of her exploitation with drugs. In fact, she was in a coma for weeks. They didn't actually think she was ever going to be able to live a full, healthy life. Because of her addiction. And she not only was trafficked for commercial sexual exploitation, but she was also trafficked. She was also forced to traffic drugs for her trafficker, like across state lines. She was effectively a drug mule, in addition to the commercial sex acts that she was forced to do. So that was kind of a new thing for me, right? I mean, I of the employees that I had, there were a couple that never had substance addictions, and then there were several that did. And seeing those that did, and the extra layer of trauma and recovery that required, was what really brought me to this issue and brought me to look at it more deeply and see how pervasive it is. So, what about you? How did you start looking at this issue?
Yeah, very similarly in a lot of ways. I think as a survivor during my own trafficking, substance use and abuse was not a part of my experience. My my trafficker, both of my traffickers had very strict rules around not using substances. But I was around the illicit substances all the time. One of my traffickers was a gang involved individual who was in the process of transitioning from drug trafficking to human trafficking.
Mm-hmm.
And so I was very aware of the intersection. And then coming into doing direct service work in the anti-trafficking field, just immediately became aware of how prevalent substance use disorders are, and also started to kind of pick up on some different themes around different typologies of traffickers and how they use substances. And then also, like you said, like overcoming a substance use disorder in addition to trauma, in addition to all these other
Yes.
barriers. It was very eye-opening at first. And then, like I said, the prevalence of it really led me to asking more questions about what needs to change so that people that are experiencing this have access to the right services and resources. So yeah. So I think before we really dive into some of this, Vanessa, it would be great to hear from you to do a level set for folks who may be not as familiar and kind of immersed in the topic of drug-based coercion as you and I. But can you define coercion for us and then draw in that piece that has to do with substances?
Okay. Yes. So this is really important to set the stage, right? To lay the foundation. So the Trafficking Victims Protection Act, as we know, passed in 2000, and they defined coercion very specifically. And so coercion in the TVPA is defined as A, threats of serious harm to or physical restraint against any person. B, any scheme, plan, or pattern intended to cause a person to believe that failure to perform an act would result in serious harm to or physical restraint against any person. Or C, the abuse or threatened abuse of the legal process. So when you look at A and B, it's basically whether there was actual threats of serious harm or whether there was a belief that there would be serious harm, right? That's really what coercion means. But as you'll note, there's nothing in that definition about the use of drugs in order to inflict serious harm or threaten serious harm. So as a result, in about 2013, the American Bar Association passed what they called the Uniform Act on Prevention of and Remedies for Human Trafficking, otherwise known as the Uniform Act. And in the Uniform Act, they propose a different definition of coercion that would include, quote, controlling or threatening to control an individual's access to a controlled substance. Now, as of about 2020, I don't have the updated statistics, but as of about 2020, 9 states had adopted the Uniform Act with this definition of coercion. So today, I don't know the exact numbers, but let's say roughly 9 to, I don't know, maybe 11 states have an actual definition of coercion in their state law that includes controlled substances or the use of controlled substances. And that's really important. It's really important. Now, importantly, we still don't have that in the TVPA, and the vast majority of states still don't have that.
Yeah. So just listening to you kind of talk through, all this formal language, sometimes can feel disconnected from like, but what does this mean in practice? But as I was listening, I was thinking about a survivor that I interviewed for one of our research projects, and she was very involved in the organization that I used to work for. And she shared a story that, so she was her pimp's bottom girl, and he used her, like you said, as a drug mule, and would threaten to or act upon physically, like he would beat her if she did not follow his instructions to the letter. But one of the things that she had to go do was go purchase substances for not just her and him, but the entire operation. So all of his victims in his household. And every morning, she had to line up all of the other victims by the door, and she would give each of them a hit off the crack pipe and then send them out to go earn their quotas for the day. And she was under this trafficker's control for several years, and eventually ended up being charged as a co-conspirator in his trafficking case. So she ended up with a felony charge there, which forced criminality. Maybe I'll have you back for a whole nother podcast topic on that. But these
Yeah.
cases, in reality, in trafficking situations, it's not just one thing, right? Like there's multiple things happening at the same time. But when I think about her story, I'm hearing all of these pieces, right? So threats of serious harm, or physical restraint, a scheme or a plan intended to believe the person would experience serious harm or physical restraint, threatened abuse of the legal process. So like he would also tell her, I'm going to call CPS and your kids are going to get taken away. And like, I'm going to get you arrested because you're the one buying the drugs. You're the one
Mm-hmm.
that is, giving all of these other women these substances every day. So using that to manipulate her and keep her scared of reaching out for help. So with all of that, and kind of thinking about her situation, and that is unfortunately like fairly common, like, different iterations of that situation. But I think a good example of that drug-based coercion on the other side of it, all of the women that were being victimized, when they would start to go through withdrawals, like he would not let them come back in the house until they had made their quota. But if they were coming down or going through withdrawal, that would motivate them to work even harder. And if they got in trouble or they didn't meet their quota, he would not give them more, which would send them into withdrawal. So kind of on the other
Mm-hmm.
side. So when I think about this situation and other similar ones, my question to you is, why does the gap in the federal law matter around anti-trafficking and drug-based coercion?
Well, that case that you just provided is really emblematic of why it matters so much. And there's also not only that, but there's also examples of debt bondage for the drugs. So the trafficker will provide them with the drugs, will induce them to take the drugs or require them to take the drugs. And then not only do they have to meet a quota before they come back, but also that quota has to be over and or what they have to make is over and above the quota, because they have to then pay for the drugs. So it's an entire scheme. And that particular victim is she was prosecuted with her trafficker. And again, the forced criminality element of that, he was putting her in a position to conduct all of these crimes to make her as culpable as he is. And so that goes back to why this matters so much. So without I mean, first of all, we have to talk about the element of who the victims are in these cases and the extent to which it is very difficult for them to testify as to what has happened to them for a variety of reasons, right? It could be that they have a distrust of law enforcement. It could be that they still feel, somewhat loyal to their trafficker. It could be that they literally are not in a state of mind. They're not stable enough to be able to testify. They could still have their addiction. They could still be in an active addiction, which makes them really unreliable as witnesses in those cases. And so for all of these reasons, it's really difficult for victims in these cases to put them on the stand and to talk about the extent to which they were induced, to take these drugs. Secondly, though, the public perception of victims of trafficking, especially those who are also addicted to any type of substance, is not good, right? So historically speaking, we have over criminalized women who are engaging in prostitution and also are, in some cases, engaging in survival sex to support a drug addiction, right? Those are not typically people that a jury is particularly sensitive or, empathetic to.
Mm-hmm.
And so the typical question is like, well, why did they do it? Why it's their fault, So for all of these reasons, it's best if the law is written in such a way that you do not necessarily need these victims to get on the stand to testify. So if you have the evidence that this trafficker has been using drugs to induce these women into committing sex acts and potentially even in some cases in making them indebted to him to pay him back for the drug use, then that's a much better way to do it by just collecting the evidence and not needing the witnesses, right? So one way to do that is to then just make it easier in the law by defining coercion clearly as, using controlled substances to control or threaten an individual. And there can be medical files, medical records used in the case to show the level of addiction that they have. But currently, prosecutors have to, well, first of all, currently, many prosecutors don't even want to prosecute cases that require proof of force, fraud, or coercion, or the means of trafficking at all, because it makes it more difficult to prosecute. So, like, I have quotes from prosecutors that have been interviewed in the past who say, "Well, what is required of you to take on a trafficking case?" And they say either the victim is a minor, so that I don't have to prove force, fraud, and coercion, or there's actual force involved, like major beatings and pistol whipping and all of those things. Yeah. So, and then you look at the statistics on federally prosecuted trafficking cases, and it is so significantly skewed towards prosecuting cases involving minor victims.
Yep.
So if we make the proof of the means, i.e. coercion, a little bit more straightforward for prosecutors to be able to then use to prosecute more cases involving adult victims, we might be able to move the needle a little bit more. And, you and I could talk forever about, traffickers who traffic adult victims are actually much more sophisticated than those that are trafficking minor victims by and large, right? There's obviously variability and it's a spectrum, but on the whole, we see much larger stables, much more sophisticated operations among traffickers that are trafficking adults. And yet we're seeing so fewer prosecutions of those cases, in part because of this gap in the law.
Yeah, absolutely. Boom, mic drop. Thanks for coming to Vanessa's TED Talk.
Okay, so, Megan, you have like more experience than most of us in this field, especially from all of the different perspectives, right? Like You come from a lived experience perspective, as well as from a direct service provider perspective, as well as from a researcher perspective. That's very unique and very rare. So, from all of the different lenses through which you can assess this issue, what would you say drug based coercion actually looks like on the ground?
Yeah. Oh man, just this whole topic has brought back just so many memories of, doing direct service. And my direct service work started in Colorado, which is where I was born and raised. And the county that I grew up in was number one in the country for meth labs when I was in high school. That was like our claim to
Claim
fame.
to fame.
Very
Yeah.
put it on the welcome to our city, number one for meth labs. Um, and so I knew that substances were around. It was not until I really got into doing direct service work and working with survivors, particularly in my community, did I fully see firsthand the impact of what that looked like. And so at that very local level, methamphetamine was obviously like a massive piece of um, substance abuse and substance-based coercion. Um, but also other substances and even, prescription drugs as well. So this
Yeah.
isn't just, street or illicit drugs. It is
Yep.
any type of a substance. Um, and so I think seeing the volume of that really changed my perspective as well. Like, I think, so this is just like a side note. I think a lot of times there's an assumption, like as survivors, we don't also have blind spots in what trafficking can look like, but we also do. So, because substance use was not a part of my exploitation, I just was not aware of the prevalence of it across types of exploitation and other people's situations until doing direct service.
Hmm.
But I also really saw how hard it was, like we said when we first started talking about this, the rate of relapse on substances and how much trauma is just around substance use and abuse and addiction, with or without coercion there. Uh, and so I would see, clients that exited their trafficking situation and started accessing services, started to work on stabilizing and healing, and maybe their trafficker would, reach out to them and kind of suck them back in, and they would, their trafficker would get them addicted again to substances. But I also saw survivors who just really struggled with the amount of trauma and moving through the healing process, and
Mm-hmm.
substances were something that it's a coping mechanism at the end of the day. Um,
Mm-hmm.
and so all of that makes it really, really hard for survivors to maintain custody of their children,
Mm-hmm.
to maintain housing, to maintain employment, um, to go to therapy consistently, to just all of the things. It impacts every single part of your life. And so it just all of, just witnessing that as a direct service provider and trying to support survivors in their journeys, I think that's when I started to ask questions as a researcher, because I started to see different patterns of how substances were used and abused and how they differed across different typologies of traffickers. And so I did a research project that came out of that, which was part of a much bigger project, but there was a peer-reviewed journal article that is a piece of that around the different third-party controller typologies in sex trafficking situations and how different ones use substances differently or how they maybe show up. So What we found in that sample, for example, was pimp-controlled sex trafficking or intimate partner trafficking. You really saw this like social introduction of substances, and sometimes like victims weren't even really aware that they were building a dependency on substances because it was in such a social setting. So it was at a party or with friends or with their intimate partner who was also their abuser. And so it just was very normalized. It was encouraged. It was welcomed, but eventually became an addiction and a dependency
Mm-hmm.
that then their abuser used that. So whether that was, again, like I'm going to call CPS and have them, do a UA, or I'm going to tell them that you're doing drugs, or I'm going to take these drugs away. For gang control trafficking, what we saw in the research in doing interviews with survivors that experienced gang control trafficking is there is, because gangs engage in trafficking of a lot of things,
Mm-hmm.
really see this like whole business model of like victims are transporting substances. They sex trafficking victims are using the substances and encouraged to sell them or forced to sell them to their customers. And so it is like there's so much money being generated. There's multiple streams of revenue happening at the same time, and much more violent. So we saw kind of the like forced drug use really with gang controlled situations. So yeah, so that really led me to doing the research piece, was just seeing it so often and then starting to see these patterns and those different typologies. There's also some trends around that we saw in those interviews around survivors who are, once they exit that situation, if they're able to detox and attain sobriety and maintain sobriety differently based on their typology of trafficking, or like if they had a substance use disorder before meeting their trafficker, as opposed to introduced by their trafficker. So I think it's really important to have those conversations, and it is so much more nuanced than I think like the media talks about, or movies,
Mm-hmm.
just like general understanding. So when it comes to what people get wrong, I think it's really, the stereotypes or the assumptions and misinformation, and really just simplifying things. And I think as a society, we really struggle with believing victims and survivors of all forms of interpersonal violence and interpersonal crimes. And so when you add drugs into an interpersonal violence situation, all of a sudden that even further discounts the victim's or the survivor's story about what happened to them. And people tend to kind of layer on that blame of like, well, maybe if you weren't, maybe if you weren't partying, that wouldn't have happened to you, or you should have made better decisions. And if you had made better decisions, you wouldn't have ended up in that situation. Um, and then also those assumptions of, especially around trafficking survivors specifically, we are not a monolith. So we
Yeah.
don't all just need the exact same cookie cutter treatment plan, resource and services timeline. And we really need to be looking into these nuances and looking at the individual experience, and recognizing when there's a substance use disorder or there's been substance-based coercion, that is an extra element that needs additional services and more time for healing.
Right. Yeah. There's so much in what you just said that we can just continue to pull back. I mean, I think that even just in terms of talking about the recovery and stabilization required for different experiences of trafficking, but how imperative it is to look at the intersection of substance rehabilitation facilities and trafficking. And I think that as as a collective, we haven't necessarily developed those partnerships, and as well as maybe perhaps we should, not only for survivors who are looking to detox so that they can actually get into a safe house or some other type of recovery program, because most recovery programs, and definitely most safe houses that I know of, you may know something different, but they do require you to be clean and
Yeah.
sober for a certain period of time. Like they are not, they just don't have the capacity and the resources to take on someone who is in an active detox. So the detox has to take place first before they can go there. But also there's been even federally prosecuted cases actually that show that traffickers recruit out of substance rehabilitation facilities. So that's just another, if that's more of a prevention thing, right? But like another way that these two fields are deeply interconnected, that I think, most people aren't aware of. But there's been not a ton of research on the issue of drug-based coercion and that intersection of drug use and trafficking. But some of the studies that I looked at as I was writing my manuscript around this is one study found that 84% of sex trafficking survivors reported substance abuse during their victimization. 84%. I mean, that's astounding, right? That's massive. Another study that was only of minor sex trafficking survivors found that 62% were forced by their trafficker to do drugs while they were being trafficked. So this is not an isolated thing, right? This is pretty pervasive among trafficking operations, and like we've been talking about, all of the different ways that they're used. So manipulating somebody's existing addiction, like the people that recruit out of substance rehabilitation facilities, or inducing them to get addicted to a substance, or they're trafficking both drugs and commercial sex at the same time. So lots and lots of intersections, and the fact that it's not only adults, it's not only minors, it's actually a pretty pervasive issue across the board when it comes to looking at sex trafficking. So I think it's so important that we're having this conversation, and and that the law catches up with what this type of coercion looks like.
Yeah. Yeah, definitely. I think those statistics just really bring home what, we've talked about anecdotally of like, we're seeing this all the time. And those statistics really highlight, this is something that's happening to most of us during our exploitation. And
Mm-hmm.
so when there is that large of a prevalence, we really do need to make sure that there's lots of education around it, that there is a reframing of what it looks like, and that drug-based coercion is codified so that it is formally recognized for prosecution. So on that note, so we're not going to comment directly on the Diddy case today, but we know that that is in the media right now, and there's definitely there's this theme of drug-based coercion and stories of survivors coming forward and talking about being forced to take substances. And so, Vanessa, I'm curious to hear from you, like with media coverage broadly, what do some of these stories reveal? Is there anything that they fall short or gaps that they highlight? I know we've kind of touched on a lot of this, but really thinking about the media component of this.
Yeah. Well, first of all, I would say, I mean, we know that in the case, there have been multiple allegations from multiple women, and actually some men as well, regarding being forced to take drugs in order to induce them to commit certain sex acts. And and as we've been talking, we're like, yeah, we're familiar with what that looks like. That's definitely not unique to this case. What I think is interesting and something that is needs to be noted is that there are so many people that have made these allegations, right? And you know, and finally, it's being taken seriously. But I do think that it is interesting to think about that question of, you know, can we do we as a society trust one woman, or do we need multiple women to come forward and say this person forced me to take drugs to perform sex acts? You know, if these cases should be, it should be one victim, one person, you know, one allegation is enough, because we know that if it's one, there's others.
Yeah.
Most of the time, if there's one, there's many others. So that is something that I think is worth noting. But it's very important, as we've been talking about, for not just the anti-trafficking community to understand the depth of the intersection of these issues, but the public as well. Why? Because the public serves as juries in these cases. And we need to destigmatize the victims in these cases. We need to get to a point where we as a society are no longer believing that she wanted it and she chose that and she put herself in that situation, and that we're understanding these nuanced and, you know, nefarious coercive techniques that traffickers use to prey on deeply vulnerable populations, so that the jury, you know, can make have the right verdict. So yeah, so I think that the probably the most important thing to me about this case is I'm glad that it's risen to the level that it has, and that it's, you know, it's in everybody's face right now every single day. And so we're hearing about the ways in which people force people to do drugs to get them to do
Mhm.
things that they, you know, maybe wouldn't otherwise do. But what I want people to understand is that this is this is not just a, you know, Diddy music industry Hollywood story, right? This is a story of thousands of women every single day across the country who are still actively, you know, in an addiction because their trafficker put them there. And those cases aren't getting the same level of attention of the Diddy case, but they ought to, and they should. And so what can we do to help ensure that more victims are supported and more traffickers face justice when they do these types of things?
Yeah, I think that's such a great point. And before we started talking about this, or before we started recording, we were just kind of talking about, you know, this, if you work in the anti-trafficking space, watching, you know, a celebrity trial and hearing these things, the tactics, as disgusting as they are not surprising because we see it so often in sex trafficking situations. And so to the rest of the world, though, who is not doing direct service in anti-trafficking, you know, sometimes these celebrity cases can be their one snapshot into
Mm-hmm.
this world around what it actually looks like to be in a sex trafficking situation or experience drug-based coercion. So I think it is really important for the media to be mindful of the influence that they have and how that does ultimately have a real world effect on other victims and survivors who have experienced the same thing, but maybe not in a celebrity situation.
Yeah. Yeah. I mean, it's great that it has risen
Mhm.
to the kind of public um, level that it has, and I just hope that people don't take away the wrong thing from it, right? So where do you think we go from here, Megan?
Man, this is like always the question, right? And it's always
Right.
this chicken or the egg of there's so much need and our laws are not quite there a lot of times to really have an at scale, really address things at scale. And so where do we go from here? I think um, really making sure that drug-based coercion is codified is really, really, really important for all the reasons. And for anybody listening, if you didn't hear all the reasons, just re-listen to this entire podcast because I feel like we've hit all of them. It's very convincing when you really, look under the hood, so to speak. Um, I think also, there needs to be more research. You brought that up. There's very little research on this. And um, really like, just speaking about my journal article alone, it is really just highlighting some themes. It's not coming from a clinical perspective. It's not coming from a treatment perspective. And so I think there's a lot of other questions that come out of that need to be answered from a research perspective, clinically as well, of if you have experienced a certain typology of trafficking and drug-based coercion, is there a different treatment modality that we tend to see better outcomes around? I am not a substance use, clinician by any means.
Mm-hmm.
And so that is not something that I can speak on, but there's also no research on it. So um,
Right.
and then like more broadly with direct services, I think, just going back to, for 8 years, I ran a job training program and I think close to 100% of the survivors that went through that program had battled substance use disorders. And so we were very used to seeing the warning signs of like an impending relapse or a relapse or maybe still an addiction and active use that was the survivor was, trying to hide it and keep it kind of under control, under wraps. But we also were really mindful in our job training program around this is a part of the journey, relapse, not just on substances, but in falling into old patterns of behavior. So that may be
Mm-hmm.
re-engaging with, an abuser or somebody from our past that is not safe or healthy, re-engaging or just defaulting to certain communication or coping skills. And so our job training program, like we really built in a lot of those mechanisms to acknowledge that messing up, so to speak, is a part of the learning process. And
Mm-hmm.
how do we look at that from a strengths-based approach and from a transparency approach rather than a shame-based approach of like, you messed up, you had one chance, now you've failed, because that's
Mm-hmm.
not productive. And what we know is that ultimately oftentimes just pushes that victim or survivor back to their abuser because they have nowhere else to
Mm-hmm.
go. And so modeling something that is different and that allows that vulnerability and that safety to say, like, I messed up, or I'm really struggling right now, or I slipped, or I need something more, and being able to really ask for it. And so creating those safe spaces, but also making sure those resources are available. So when a survivor says, the support I'm receiving right now is not enough, and I am needing something else, that is also available for that survivor. So I think, drug-based coercion and substance use disorder is just one really powerful example of time-limited services for victims and survivors of trafficking is really tricky.
Mm-hmm.
And a lot of times it's not beneficial to the survivor because we are coming from different places. We have different levels of trauma and different things that we are working to overcome. And so just saying like, well, at 6 months, all survivors should have, X, Y,
Right.
and Z, it's just not
Right.
realistic to do that.
Right.
So I think that's another piece of when we think about our systems and how we support survivors. Those are some things that immediately come to mind. Do you have any other ones to add? I'm
That
sure you do.
was super. No, I actually don't. That was extremely comprehensive. So we have policy work to do, we have research to do, and we have the need for more specialized care for survivors battling substance use disorder.
Yeah.
Like those I feel like you wrapped it all up. Like though that's where we go from here. I
Yeah.
think you gave us a path forward.
Boom. So we have work to do. We've got our action items. So
That's
my
right.
my last question, Vanessa, is what would you want someone to understand if they heard a survivor's story that included drug-based coercion, and you heard somebody say, "Oh, she was using or she was taking substances." What would you want that person to understand?
I would want that person to ask why.
Mhm.
The fact that she was using is there's some reason behind that, right? And like you said before, it's typically a coping mechanism for something. And so if that victim was using because they were being forced to use and they would not have necessarily had that addiction or that, disorder apart from having experienced the exploitation, then that's a really important thing to note. If the trafficker is exploiting an ongoing substance use disorder that the person already had, then it's still important to ask why, right? That all of the vulnerabilities that led them to um, use those drugs in the first place are similar to the vulnerabilities that would have led them to be trafficked with or without the drugs. And so we need to be looking at the systemic, vulnerabilities that certain subgroups in the population face. And so I think the more important question is not, well, the statement is not, but she was using. The statement is, we should turn it into a question. Why was she using?
I think just listening to you talk about that, I think, when I first started learning about ACE score, the adverse childhood experience um, test, and the different um, questions on the ACE score, one of the reframes that the ACE study gave me as a trainer and as a direct service provider was the ACE score and the study and those findings um, shifted questions around what's wrong with you to what
Mm-hmm.
happened. And so I think it's the same thing. And so, the ACE score really initially looked at like physical health and like chronic health conditions. But I think from like a trauma and just somebody's journey, like what is your story? What brought you
Mm-hmm.
to this point?
Mm-hmm.
And maybe that's our social scientist researcher
Yeah.
brains as well of like, but what? Like, tell me more. Um, and so, yeah, so I would just echo what you shared of I think it is this reframe of just making a statement or like a judgment or a values-based decision of like this was bad or it's just this cut and dry, she was using, therefore she can't be believed. Um,
Right.
to
Right.
really thinking about this more holistically and thinking about what was the journey, what got you to this place, what happened, why are these substances being used. I think
Mm-hmm.
that really starts to paint a fuller picture of the experience, whether that's directly with that trafficker or that individual's journey, from childhood into that point of exploitation.
Right. Right.
Well, I feel like, Vanessa, we could obviously talk forever and definitely probably need to have you back since we have so many things to talk about. Um,
Let's do it.
yeah, but thank you so much. This was great and really hoping that folks will think about drug-based coercion a little bit differently. And like you said, we have a to-do list. We've got work to do, so let's do it.
That's right. We do. Thanks, Megan.